For decades, vitamins have been hailed as the cornerstone of proactive health, a way to fortify our bodies against the ravages of time and illness. Multivitamins line pharmacy shelves and advertisements tout their power to boost immunity, sharpen memory, and, most importantly for older adults, protect the heart and brain. But what happens when the very nutrients we trust to keep us healthy begin to pose unexpected risks, especially to our most vital organ, our brain? Recent research has uncovered a surprising twist in the vitamin story, one that every senior and their caregivers should hear. The focus of this revelation: certain vitamins, when taken in excess, can actually elevate your risk of having a stroke, sometimes dramatically and even overnight. Let's start by understanding what a stroke is. A stroke occurs when blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients. Within minutes, brain cells begin to die. Strokes are a leading cause of disability and death worldwide, especially among older adults. Preventing stroke is a priority in senior health, and many have turned to vitamin supplements as part of their strategy. But the latest findings suggest it's not as simple as reaching for a bottle. Among the vitamins scrutinized by recent studies, vitamin D stands out as both a hero and a potential villain. For years, vitamin D has been championed for its role in supporting bone health, immune function, and even reducing the risk of chronic diseases. However, new research has revealed a concerning downside. Excessive intake of vitamin D can lead to calcium buildup in the blood, a condition known as hypercalcemia. This calcium overload doesn't just affect your bones, it seeps into your arteries, causing them to stiffen and lose their elasticity. Stiff arteries mean increased blood pressure and a higher likelihood that a blood clot could become lodged in a vessel feeding your brain, triggering a stroke. The risk isn't limited to those who take vitamin D for years. In some cases, particularly with high-dose supplements, the risk can escalate rapidly, even overnight. For older adults, whose arteries may already be less pliable due to age or other medical conditions, this added stiffness can tip the balance from healthy to hazardous. And it's not just a theoretical risk. Reports have documented episodes where seniors, after starting high-dose vitamin D supplementation, experienced acute neurological symptoms within days: numbness, confusion, trouble speaking, all warning signs of a stroke. But vitamin D isn't the only supplement raising eyebrows in the medical community. Vitamin E, another popular antioxidant, is widely used to promote brain and heart health. However, its interaction with certain medications, particularly blood thinners like warfarin, can be downright dangerous. Vitamin E enhances the anticoagulant effect of these drugs, making blood less likely to clot. While this can be beneficial in preventing some types of stroke, it also increases the risk of bleeding in the brain, known as a hemorrhagic stroke. For seniors already on blood thinners, adding vitamin E supplements can push the risk of a brain bleed to alarming levels, sometimes with little warning. Vitamin B6, often found in B-complex supplements, is praised for its role in cognitive function and energy metabolism. Yet, when taken in high doses, vitamin B6 can cause nerve damage, a condition called neuropathy. Symptoms include tingling, numbness, and muscle weakness, symptoms that can closely mimic those of a stroke. In older adults, distinguishing between vitamin toxicity and actual stroke can be challenging, sometimes leading to delays in critical treatment. Then there's vitamin A. Essential for vision and immune health, vitamin A is another nutrient where more is not always better. Excessive intake can lead to toxicity, causing increased pressure inside the skull, a condition known as intracranial hypertension. The symptoms? Headaches, vision disturbances, and even loss of consciousness. Intracranial hypertension can mimic the signs of a stroke and, if untreated, can cause permanent damage to the optic nerves and brain. Niacin, or vitamin B3, plays a role in cholesterol management and cardiovascular health. But in high doses, niacin can cause dramatic swings in blood pressure. For seniors, whose blood vessels may already be compromised, these fluctuations can increase the risk of both ischemic strokes, where blood flow is blocked, and hemorrhagic strokes where blood vessels rupture. These revelations have prompted a reevaluation of vitamin supplementation, especially in older adults. A systematic review and network meta-analysis published in May 2023 provided a comprehensive look at the efficacy of various vitamins in preventing stroke. The study found that vitamins A, B complex, B6, folate, C, and D were significantly associated with decreased stroke risk when taken in appropriate doses. Among these, vitamin D was ranked highest in efficacy for stroke prevention. However, the study also found that vitamins B2, B12, and E did not show significant protective effects. More importantly, it emphasized that benefits are dose-dependent. What protects in moderation can harm in excess. So, what does this mean for seniors and those who care for them? The key takeaway is that vitamin supplementation is not a one-size-fits-all solution. The risks and benefits must be carefully weighed, preferably under the guidance of a healthcare professional. For those considering vitamin D supplements, it is crucial to have baseline blood levels checked before starting. Supplementation should be tailored to individual needs, factoring in age, existing medical conditions, and current medications. The days of indiscriminately popping high-dose vitamins in the hope of better health are over. Precision and moderation have become the new gold standards. Healthcare professionals now advocate for a less-is-more approach, especially with fat-soluble vitamins like D and A, which can accumulate in the body and cause toxicity. Routine monitoring of blood calcium levels for those on vitamin D, regular checks for signs of nerve damage with B6, and careful management of blood pressure for those on niacin are recommended. Seniors on blood thinners should consult their doctors before starting vitamin E supplements, and those with vision changes should be evaluated for possible vitamin A toxicity. But what about dietary sources of these vitamins? The good news is that vitamins obtained through a balanced diet rarely reach toxic levels. The body has mechanisms to regulate absorption from food, but supplements can overwhelm these safeguards. For most seniors, focusing on a diet rich in fruits, vegetables, lean proteins, and whole grains will provide adequate levels of essential vitamins without the risks associated with high-dose supplementation. It's also important to recognize that the allure of supplements often stems from the desire for quick fixes. The promise of one pill a day to stave off aging and preserve cognitive function is tempting, but it's rarely grounded in scientific reality. Recent findings remind us that more is not always better, and that the path to brain health is paved with informed choices, regular checkups, and, above all, moderation. For caregivers and family members, vigilance is vital. Watch for new or worsening symptoms in seniors who have recently started vitamin supplements: confusion, difficulty speaking, numbness, headaches, or vision changes. These could be signs of stroke or vitamin toxicity and warrant immediate medical attention. The evolving science of vitamin supplementation is a reminder of the complexity of our bodies and the importance of individualized care. Seniors are particularly vulnerable to the side effects of excessive supplementation due to changes in metabolism, decreased kidney function, and the presence of multiple medical conditions. What works for one person may be harmful to another. Blanket recommendations are no longer sufficient. So where does this leave us? The message for older adults is clear. Vitamins can be powerful allies in the fight against stroke, but they must be used judiciously. A recent meta-analysis underlines the protective benefits of vitamins A, B complex, B6, folate, C, and D. When taken appropriately, vitamin D, in particular, has shown promise in reducing stroke risk, but only when blood levels are monitored and dosages are properly adjusted. The risks of vitamin E in those on blood thinners, the nerve damage from excess B6, the intracranial pressure from vitamin A toxicity, and the blood pressure swings from niacin should all serve as cautionary tales. As research continues to shed light on the nuanced relationship between vitamins and stroke risk, healthcare professionals are adapting their advice. The era of blanket supplementation is ending, replaced by a more personalized approach. Seniors are encouraged to speak openly with their doctors about every supplement, no matter how innocuous it may seem. Routine blood tests, medication reviews, and ongoing monitoring can help ensure that the benefits of vitamins outweigh the risks. For those seeking to protect their brain health and reduce stroke risk, the foundation remains the same: a balanced diet, regular exercise, blood pressure control, and management of underlying conditions like diabetes and heart disease. Supplements may have a role, but only as part of a comprehensive plan tailored to individual needs. The latest research is a wake-up call, reminding us that even well-intentioned efforts can have unintended consequences. As we age, our bodies become more sensitive to both the healing and harmful effects of nutrients. The goal is not to abandon vitamins, but to use them wisely, respecting the delicate balance that keeps our brains healthy and resilient. In conclusion, the shocking discovery that certain vitamins can raise stroke risk overnight, especially in seniors, should prompt a shift in how we approach supplementation. Excess vitamin D can cause arterial stiffness and increase stroke risk, while vitamin E may interact dangerously with blood thinners. High doses of B6 can damage nerves. Vitamin A toxicity can mimic stroke symptoms, and niacin in excess can destabilize blood pressure. These risks are not theoretical, they are real and immediate, sometimes manifesting in a matter of days. The solution is clear: moderation, monitoring, and medical guidance. Seniors and their caregivers must stay informed, vigilant, and proactive, embracing the latest science to ensure that vitamins serve as protectors, not hidden threats, to brain health.